Since the start of the pandemic, more and more people have had to turn to nurse practitioners instead of doctors for their health care needs, especially in rural areas.
And now new legislation could give those practitioners a little more independence. If passed, they wouldn't have to have some of their work checked by doctors.
News Channel 5's Kyle HORAN has details.
This is something the Tennessee Nurses Association has been trying to make happen for a couple of years now. They want to sever the relationship of doctors, their oversight, over nurse practitioners here in the state.
Well, he was having leg cramps and
We've had this conversation before in McMinnville. THERESA Hill owns a family care clinic. We first visited her back in 2019.
For a family practice, for most patients, nurse practitioners can take care of 80% of the problems just as well as physicians do.
Since then, there hasn't been a law to allow Hill to practice without a physician checking her charts. The Tennessee Medical Association, an advocacy group representing Tennessee doctors, says they believe the nurse practitioner-physician relationship is important because patients get better care. The Tennessee Nurses Association believes that's not true in this case because while charts have to be checked on about 20% of patients who are prescribed medication, 30 days is too late to make any meaningful change anyways.
After 30 days, there's no real action happening to help. It's 30 days after, so the patient has already gone home with that prescription and has been taking it for 30 days.
Julie Mann is president of TNA. They're talking to lawmakers about how to change the rule. Their idea is to end the chart review after a nurse practitioner has been in business for 3 years.
It's not real time having any effect on what we're doing with the patient. If I have a question, I'm going to call right then real time and collaborate as I always would with a physician. Collaboration never goes away.
Dr. Kevin Smith represents the physicians in this case. He says they'd like to keep that relationship intact.
The physicians of the state are very concerned. We don't share the same opinion that there's no value to it. We feel like there might be safety issues that would arise in having a nurse practitioner not be collaborating with a physician.
Smith points to the difference in education in nurse practitioners who have upwards of 2 to 3 years of education after college, while physicians have 4 years of medical school and then 3 years of residency. He says there should be a conversation about how the state might do it better, but removing chart review isn't the answer. Kyle HORAN, News Channel 5.